Aseptic technique is important, especially in any sterile area or environment. This can be achieved through disinfection and sterilization. Glutaraldehyde is used as a cold sterilant in disinfecting and cleaning heat-sensitive equipment such as dialysis and surgical instruments. This remains one of the few substances capable of high-level instrument disinfection in modern healthcare. Many studies have showed the effectiveness of glutaraldehyde in various dental instruments such as cardboard floor, dental impression materials, and dental. Another study also showed the antimicrobial activity of glutaraldehyde in destroying bacterial spores and fungi. Despite its effectiveness and usefulness, glutaraldehyde poses a great risk for individuals exposed to it. Studies have shown that exposure to vapor or direct contact results to asthma, chronic bronchitis, epistaxis, and other respiratory symptoms, also skin rash and contact dermatitis. Adding to the dangers are the high-risk work practices, such as inadequate use of personal protective measures when handling such toxic substance. Despite this problem, policies being made regarding this are unclear. The Australian Nursing and Midwifery Federation has issued policies regarding ways in handling this chemical. However, in the Philippines, different policies apply to different hospitals, and as a matter of fact, there seems to be lacking in policies nationwide in handling this chemical and guidelines in reducing occupational hazard that this imposes to the nurses and workers.
I'm Bertine, Niyomfura.
And I am Decxelnarjoy, Ragas.
The effect of glutaraldehyde on the bacterial count
Of surgical instruments. This study seeks to answer the following questions. What is the bacterial count before soaking to glutaraldehyde? What is the bacterial count after soaking the surgical instruments for 15 minutes, 30 minutes, 45 minutes, 60 minutes, 75 minutes, 90 minutes? What is the bacterial count after soaking of surgical instruments with the same time series but with different concentration of 2%, 5%, and 10%? Is there any significant difference in the bacterial count before and after soaking of surgical instruments after 15, 30, 45, 60, 75, and 90 minutes? Is there a significant difference in the bacterial count before and after soaking of surgical instruments on different concentrations of 2%, 5%, and 10%? The researchers will gather their sample at the Adventist University of the Philippines Hospital, and gathering, they would then go to the CST Micropara laboratory for them to conduct their experiment. With materials ready, they would first swab the instruments, then soak them into 3 kinds of glutaraldehyde concentrations. After 15 minutes, they would again swab the instrument, soak it again, and the process would repeat after 30, 45, 60, 75, and 90 minutes. In getting the bacterial count, the researchers will then go to the Medical Laboratory Science Department for them to give their specimen to be analyzed. The researchers will then gather the data from the MLS laboratory. This research will utilize experimental study as a research design. The researchers will also use quantitative method in gathering the needed data where they may draw the conclusion. Analysis of data. The researchers would use mean, standard deviation, ANOVA, and MANOVA.